Hey guys, welcome back to my YouTube channel. It's Mom's Diary with Stace here. Guys, I know it's been so long. I sat here to make a video. Yes, and it feels a kind of strange, like as if it's my first time of being here. But nevertheless, I'm here right now. Okay, so how are you guys doing? How have you guys been? Like, I'm so sorry. Like, I'm so sorry for staying for this long. Like, it wasn't planned. Some things happen in life, and we just have to accept it that way. So, I know 7 months ago, I wrote something about the arrival of my baby. Yes, and in few days from now, we're going to be 8 months. To God be all the glory. So it's not been easy. Like it's not my first baby, anyways. This is my for those following me, you know, it's my second baby. But it's not been easy. Every child comes on its own. So this one was different and it was not easy. So I just had to stay away because a lot happened in my life. So I just had to stay away. It wasn't intentional. So I'm sorry about that. But right now, we are back and we move harder. We are back, okay? So if it's your first time watching my video, if it's your first time seeing this face, you're welcome. I welcome you especially. Please, what you will do for me to be a member of this family, to subscribe to this channel, you turn on your notification bell so that anytime I release a new video, you'll be the first to see. Please don't forget to like this video and share. Don't forget to give this video a thumb up and share. Everything is free of charge. And to my old subscribers, I saw a video. I was moved to make this video as my first welcome video because I'm in it already. And I think out of experience, I can share one or two concerning what I'm about to talk about. So it's about teaching in children. So I saw this video. A lady was complaining about her child that has refused to eat, and the child is up to collecting solid, but the child has refused to eat because of teething, and that the only thing it does is to to suck. He has been sucking, and her breast everywhere is just swollen, and she was just lamenting, complaining. Like I could feel everything she was saying in that video. I could really feel the way she's feeling because I'm in that situation. Mm. So she was asking of ideas on what to do. I went to the comment section and I saw people calling this drug name pecan. Pecan that they were referring, like trying to recommend her to get pecan. My baby is 7 months and we have been experiencing teething since 4 months, and it has not been easy. I'm saying this out of experience. It has not been easy. Usually people will say for babies who will be exclusively breastfed that they find it difficult to take solid. Okay. Um for my first daughter, I did exclusive breastfeeding. But for my son, I couldn't due to some reasons, some genuine reasons, because I'm a fan of exclusive breastfeeding. So, but I couldn't this time around. And then I was expecting him, by 6 months to at least kick off with eating solid. But my baby couldn't. Instead, we started eating. Jidena refused to collect anything apart from breast milk. Even his formula, he stopped taking. Even his formula, he could reject. Like he could cry and cry. You could force him. In fact, what he usually do is once you prepare the food, and he sees it, once you're bringing his beam, so to put his beam on his neck, Within how many minutes he will just sleep off. Like he would doze off. And it will take up to 10-15 minutes. He's awake. By the time you bring another food, the same thing. So it was tiring. Like it was traumatizing. We even went to the hospital. Yes. I remember taking him to the hospital 2 times, two different hospitals to complain. Instead, they gave us some multivitamins and they were like, it's that he will outgrown it. That is just for now, because they were able to look at his teeth and they realized that his gums were swollen. So they're like, he will outgrown it. But as a mom, the way that lady was feeling was the way I felt. Like I could call my mom, I could cry. Like, why talking to my mom on the phone? I will be crying. I will call my friends, complain to them, like everybody's idea, everybody's suggestion, I will just collect. And I'll, try to do it. And at the end of the day, nothing. So a friend of mine told me about a particular medicine, let me not call the name, that it's working for her daughter. So she asked me to take it to try give Jidena, which I did, and it did not work. So when I saw this video, I remember this particular medicine called Pika because I used it for my daughter, but her teething wasn't as severe as Jidena. You see the way they say that children are different, it's true. Jidena's own was as if I don't even know what teething is all about. Like I never had an idea of it. Like I had to start reading about it because it came on a different level and I was just confused. So I remembered Pecan that I once used it for my baby girl. And during that time, I usually buy the medicine for 6,500. So when I saw on the comment section, everybody pick up, I was like, this medicine is not more, oh. It's not 2,000 naira medicine because most of these teaching medicines are like 2,000 So I was like, this is not 2,000 naira medicine, oh. So I said, okay, let me tell hubby to get the pecan for us because I've tried everything. I've changed all his food. Like you can imagine a baby I had planned for that we're going to go through organic, And then I was like, I'm not gonna get anything from the supermarket. I'm just going to give him organic, I'll do my puri and and at the end of the day I did everything. I made pap that children usually like for him. So I was like, let's try the pecan, let's see if it's going to relieve him of the pains he's feeling because I know teething can be discomfort. Like even me as an adult, I have experienced toothache and I know how it is. Anything that has to do with teething, I know the pains that comes with it. Let alone a child that cannot talk. I was like, let's get pecan. Mm. So we went and we bought that medicine. That medicine was sold for 33,800. This medicine, I bought it 4 years ago. My daughter is 4 years now. I bought this medicine 4 years ago, 6,500. Now this medicine is 33,800. Hey, it's our country. Okay, so we bought the medicine for 33,800. Even when hubby bought it, when he told me how much, I was like, why? I even forgot when I was on the go, I forgot what I was passing through with teaching with this boy. So I was like, why did you buy it? Why did you go and buy the medicine? Why is it that expensive? What's special about this medicine? I was like, what's special about this medicine? I was just angry, like, why I had to buy it for that amount. But for it to be that expensive, there is a reason. So I started giving it to my boy, and I could tell you because whatever I'm saying here is the truth. I'm not trying to promote any products here, but I'm telling you guys the truth. Whatever I'm saying is out of experience, like I said, is out of experience. So I could say that my boy have started eating gradually. He has not gotten to that point that I want him to eat. It hasn't gotten to that point, but at least I know little by little something is entering, something is going down because then nobody will tell you anything about eating. I will lecture you. I know what I passed through. Then my boy doesn't eat, nothing enters. Like he throw everything out. He will pour everything on your body. So, but since I started giving my notice, at least it's not as if he must not finish it. And I started making smaller quantity, but he must not finish it. And he may eat well in this feeding. In the afternoon, he may not eat that well, but at least I know it has improved. But now my question is, for those that do not have that money, for those that their children are undergoing cheating, and they don't have that money to buy pecan for 33,800, what will they do? So I am here for those people. Yes, I am here for those people. So I know it's difficult because it can be traumatizing. I know where I was before now. I know the way I was acting, the way I was feeling. Like my husband could feel it that this lady is not happy. I know the way I was feeling that my baby was not eating. But I'm here to tell mothers that their babies are having such problem. Mothers that are having such problem. Mothers that are not happy with themselves that their babies are not eating. I want to tell you that that baby will be fine. Seriously. Like teething is just a phase. It's just a period. By the time that baby gets better, by the time that baby becomes a little bit relief, that baby will eat as long as that baby is a baby that eats. Because we have children that are picky. We have children that don't like food. So you don't expect the baby to eat the way normal, the way those food is used to eat. You understand? But if he's teething, like teething is the reason why this baby is not eating. Believe me, relax. This baby will eat when the baby gets a little bit of relief. And what you do to help this baby, make sure you clean up the baby's gum. Either you wash your hand properly and try to massage the baby, or you look for his towel, all these little small towels for babies. Try, massage the baby and also cleaning of the tongue because sometimes, usually they usually have this irritation when you bring the food. They don't want to eat because as if it's making them to throw up. They feel irritated. So you also try to make sure their mouth is also clean. Make sure their mouth is like try to improve your hygiene level when it comes to their mouth, so that it can also help them to eat. So I'm here to tell you that that baby that is undergoing teething, as long as it's teething, that baby will be fine. Because usually they may not want to take solid, but they want to depend on this because they usually use it to rub on their gums, their itching gums. And it can be painful, I know, but this can sustain them. They won't die. Nothing will happen to them. Like, I don't want you that is listening to me to experience what I experienced. I don't want you to go there because I know where I was coming from. I don't want you to go there. Don't put your mind there. That baby will be fine. Just do your best. Take the baby to the hospital. Let a pediatrician dentist take a look at the baby. As long as it's teething is a face, that baby will be fine. If you have the money to buy pecan, fine. You can get it for the baby. But if you don't have, help the baby to rub his or her gums. Make sure you wash your hands properly. You help the baby to massage his or her gums. No matter the quantity the baby eats, that baby will be fine. the God that gave you the baby will sustain the baby, and the baby will recover. The baby will eat. The baby will be fine. Yes. So that's the reason why I'm making this video, because I saw the video the woman made and I was like, this is me. This is me. That is, if I've not even got to a worse place than her, but this is me. But I thank God. So don't give up on anything. Keep giving that baby food. If he doesn't eat, if she doesn't eat, anyone she eats, anyone he eats, it's fine. If it's breast milk, try and be giving them breast milk. But please relax, because that baby needs you to be fine. That baby needs you to be strong. So relax and just take it as part of experience. Like they come in a different way. Like this is my first time of experiencing teething in a child. This is my second baby. And I think with my experience for two is enough for me to give you that your baby is undergoing teething and advice that your baby will be fine. Don't forget to like this video and share. Share to all mothers. Share to all awaiting mothers. Share to all single women that want to be mothers someday. So guys, you'll be seeing more of this face. Don't forget. Turn on your notification bell. I'll see you guys some other time. I love you guys. Bye.